Hello, good evening friends. I am Dr. Irregular. I welcome you to my channel, Dr. Bavdekar's Homeopathy. Friends, as I mentioned last week, today's topic is very important from ladies' point of view. I am going to talk on the topic of irregular periods. It's going to be a little of 10-12 minutes, but I request everyone to listen it to the end. I am going to give you good tips which are useful in diet, day-to-day practice, and good homeopathic medicines which give sure results. Friends, menses or irregular periods, these are very common in all age groups I have seen. If neglected or if not properly treated, it leads to surgeries of the delicate organ. So we should all understand what are irregular periods, oblique menses, and we should approach accordingly. So today's lecture, I would request everyone to listen very carefully, and if you have any comments or if you have any request, you can put it in my comments box. My all other videos and other are given in the description box. So friends, periods is a cycle which begins at the 12 to 13 or 14 years of age in every female. It's a sign of maturity. It's a girl becoming an adult. So periods time starts at that time. So from that time till the periods end, everyone faces some or the other problem in the periods cycle. Usually, our physiological books have mentioned that the cycle is for around 28 days. So, after every 28 days, patient can get periods monthly. The females who have got good health and in whom the organs are properly functioning, their cycle is usually day to day, that is 28 days plus or minus some 4 to 5 days before or after. A little bit before or after is a physiological thing, it is absolutely normal, it is nowhere a disease. So females should never become panic that every month my date to date cycle comes and this time it is 4 days before or 4 days afterwards or 5 days afterwards. No friends, it is normal. It is not called as irregular periods. What do you mean by irregular periods? Irregular periods means those who have no time. They come after 1 or 2 months, they come twice a month, they last for 4 to 5 days normal periods, but in some patients they last for only 1 day or few hours I have seen. And some females complaining of 20 days continuously starting the periods and they have the bleeding problem. These are all come under the heading of irregular periods. So we should understand that. I'm not going in a technical way or in medical way, but I'll tell you in short at least some introduction that there are hormones necessary for these menses to occur in a healthy female. I will just mention the names. The hormones are like follicle stimulating hormone, luteinizing hormone, estrogen and progesterone. Now, delayed periods are not always associated with disease. Always think delayed periods or irregular periods. Think of natural things also. I'll tell you a few of them. But most of the time, these irregular menses, we consider them in single heading, that is FUH. That means functional uterine hemorrhages, which means the menses are too early or they are too late. We will understand the physiological or the natural causes where the menses can be delayed or it can be irregular. See, during menarche, when a newly menses start in a young girl, probably first 2 months they may be normal. After 1 or 2 months there may no periods. Again it will come down. So the uterus is an organ which has started functioning from 12-13 years of age of a young girl. It has to take at least a year to settle down to have every month a regular menstruation. So fluctuation in the first year after beginning of menses is very normal. So one should never become panic. Especially the mothers should keep in mind for their daughters. Okay. Then during pregnancy, of course, there are no periods. During lactating, when the baby is on breast milk, there is no periods because there is a hormone called as prolactin and it suppresses the menses. So the periods are not there. Then perimenopausal age, when the menopause, when end of period comes, that means at the age of anywhere between 38 to 50 years, there can be fluctuations in the periods, there can be irregularities, but these are natural. One should never take them as a disease. So one should keep that in mind. Now, some disease conditions are also there that cause irregular periods. What are they? The list is very big, but I will tell you it's very common, which we see the diseases. They are the thyroid diseases, hyperthyroidism or hypothyroidism. In females, hypothyroidism is mostly seen in majority of females. Then in case of PCOD, where the female is having PCOD disease, prolactin hormone fluctuations are there. So in such cases, there can be irregular periods. We can see it in fibroids, patients having endometriosis. There are a list of diseases where the periods are irregular. There may be chronic organ failure in case of elderly females, where there is a chronic kidney failure, liver failure, interstitial lung disease. So may all organ diseases can cause irregular periods, and it is called as pathologically irregular periods. Some medicines and hormone preparations if the female is taking, that can also lead to irregular periods. Patients are on anti-cancer treatment, anti-TB treatment, they can have irregular periods. Now, what is the management? How to manage these basically irregular periods? If you think in one angle it is very difficult, from other angle if you see it is very easy. First, a patient should get good investigated to find out the cause of the irregular periods. If no cause is found and physiological cause is there, then nothing to worry. If there is a cause which is medical cause, it should be taken help. One should take help of a gynecologist or a good homeopath or both, and then get treated to avoid surgeries. So first get investigated. Ultrasonography is one of the good investigations which we routinely do to diagnose this problem of irregular periods. Now what about the diet? When you suffer from irregular periods, apart from the disease or the pathology or the physiology, let's think about the diet. See, everything counts upon what you eat, how much you eat, how many times you eat, and is your diet balanced in carbohydrate, proteins, fats and fibers. So take help of a good dietitian to have a good diet. I will not go in details, otherwise the lecture becomes very big. Then body hormones are also responsible, the body hormones are responsible for regulating the menses. They are best released as per the circadian rhythm of day and night. So biological clock is very important. Sunrise to sunset, one should be awake, one should work, and after sunset have little food and go to bed. Nowadays in this fast life, nobody follows this. People follow their own shifts, they follow their own routine where they sleep late at night, get early either in the night or late in the morning also. Sometimes they get at 10 o'clock in the morning because they sleep only at 1 o'clock because of their duties, their professions, their jobs, they're all that IT work. So biologically, basically we should try to maintain the biological clock. Circadian rhythm has to be balanced because the hormone control the menses, and the hormones from our pituitary gland, which is inside the skull, it does not know whether it's a day or night. And if you disturb the day and night cycle, the release of hormones is all irregular and periods become irregular. Now avoid plastic things, I would suggest to females, or it's for both actually, because estrogen, progesterone are the hormones which are maximum responsible for regularizing the menses. Estrogen takes the majority of role, and these plastic things, they usually have xenoestrogen present in them, which fluctuates or disturbs the estrogen levels. So plastic containers, things, bottles, then food packs should be avoided because excessive xenoestrogen should not go in body. Now what is the home approach to regularize irregular menses? I will tell you. Reduce the stress. Stress means both physical and mental. Physical means working for 12 hours. There is a stress on the body which causes the hormones to disturb. Then mental stress. If somebody has got his own way of thinking small things in a big way, taking small tensions, anxieties, then worries, somebody have his own way of nature. So this has to be corrected. So stress to be corrected. Maintain the biological clock which I told you. Maintain the BMI of your body, that is the diet and exercise should be regular per day. That is very important. In during periods you can take ginger, cinnamonium, which relieves the cramps. That's a small thing. Vitamin D deficiency if there, it has to be corrected because nowadays sunlight is not available, or even it is available in the good timing when we get vitamin D. Females never go and have sunlight. So best thing is to check the vitamin D3 levels and have them corrected. Now this topic is very big. Now in short, I will go through homeopathic medicines which can be given for irregular periods. My observation is these medicines are very effective, harmless. They regularize the periods, they regularize the hormones, and the patient can get permanent rid of this problem. Of course, the patient should not try on his own. Take help of a good homeopath, if possible gynecologist also, and then take the medicines. According to the problems, I will mention few medicines. I will not go in the details of the medicines and their keynote symptoms. I will introduce you everybody the name of the medicines. Normally the potencies are 30 to 200 to be given 4 to 5 days or sometimes 15 days, and within this period everything settles down is my practical observation. So today I'll introduce you a few names of effective homeopathic medicines for irregular menses. Now, if the period is variable in long intervals, means it comes about 2 months, then it comes 3 months, again it comes, sometimes it doesn't come for 4 months, the best thing is to give sulfur. To begin the case, it's a good antisoric remedy which has to be first given and then started with the indicated medicine and slowly go towards the constitutional medicine. In case of fibroid disease, if periods are irregular, the good drug is phosphorus, then hydrostasis as well as thalapsy BP, that is Bursa pectoris. These are the effective medicines where we see fibroids and irregular periods. In young girls, those who are in teenage, just begin with the menses. Normally, homeopaths are in the mind that only one and one drug is sepia or another is pulsatilla. It's not so. Our books have mentioned that lepis alba, people usually use this drug for lipoma, but it is one of the best medicine for irregular menses. Senico, and for irritable girls who get angry, young girls are usually angry because of their growing age, chamomilla is one of the good drug for them. Now, patients who have sedentary habits, means some girl is posted somewhere in her job, there is nobody to talk with her. When she comes from the duty, she is alone and she lives a single sedentary life only by looking at the laptops, the screen, the WhatsApp. Hence the hormones get disturbed, sleep, diet, nothing is count off. So in such girl, citrulose colosynthesis is one of the effective medicines which can be given. So we should keep it in mind. Now, menses which are having irregular time and irregular intervals, means time means they come anytime. After a month they can come in the sleep, they can come after 2 months, or twice in a month, then it can come 3 months. For such things you can give Semisifuga, Coccus cacti and Nux moschata. These are one of the effective medicines. Irregular periods with much pain, that is called as dysmenorrhea, one can think of Senico, Caulophyllum and Cyclamen. Now we see many people, female patients tell me, sir, मेरा periods alternate month आता है. This is very common. You must have seen in your general practice or family practice. So if the periods are coming alternate month, give them a dose of syphilinum as a nosode for introductory part, wait for some times and then give thalapsy bursa. They will surely regularize their irregular periods. Sometimes the menses come very late and patient says that I have more flow when I do any kind of motion or any kind of physical work or I lift anything. For that, erigeron, epicac and sickle cork, these are one of the good medicines. Some females after 30 to 35, 40, 45 years of age, they suffer from endometriosis, that is a pathological conditions. So in such patients, Pagum harmala, Ravalfia serpentina and Xanthoxylum, these are the effective medicines to regularize their periods. Ravalfia was used as a blood pressure lowering measure, but this is another use of the drug for maintaining regular menses. So definitely homeopath should give this medicine and see. Now, if there is PCOD, this is a very common problem in young girls and adult females. So, depending on the location, the drugs I will suggest you which are very effective to regularize the menses. Suppose there is a PCOD on both sides which is seen on sonography. Drug like Bovista and carcinosin, they work wonderfully for such conditions. If there is a left-sided PCOD, Murex is one of the good drugs which acts very well for that. If only right-sided ovary has got a cyst in that, one can think of Epis and Calibachrome. Now, these all complaints are unending. Every female may have a different observation, different complaints, different occurrences of menses. Homeopathy is a very simplified science. But I'll tell you a good remedy where you don't understand anything and you want to regularize the periods of your patients. So in such patients, I usually advise Ashoka Janossia, mother tincture. You have to take 50 drops twice a day for around 2 months or maximum 3 months, not more than that. All the menses, they get regularized without any problems, without any hormone pills, without any excessive things. Of course, patient should not self-medicate. He should consult a homeopath and then take these medicines. So friends, I have tried to simplify this talk on irregular periods. I am sure homeopathy will definitely help everyone to regularize their periods except surgical cases, because if it is necessary, surgery cannot be avoided. But if in the initial stage of the disease, if you diagnose the case properly and give these medicines, not only the disease comes down, but the period problem settles forever. So I hope you have enjoyed this lecture, had some bit knowledge. The subject is very vast, and would have heard some other drugs, but some new drugs I have tried to mention over here which are equally effective. So I thank everyone for a patient hearing and also giving me an opportunity to talk to you. Good day, everyone.